Welcome to A Place of Possibility. We are happy to have you here with us. I am Richard Del Monte.
I'm Angela Wright, and today we are talking Medicare.
Medicare. Awesome. I am shocked. No, I'm not shocked. People just don't understand how this how this works, right?
Which is insane to me because everybody who's 65 signs up for this. And you would think that, the powers that be would make it really clear and really easy. But we all know that's not what our powers do.
It's clear as mud instead. And so people wait until a month or two before they're going to turn 65, and then it's just a mad scramble.
Totally.
So what we want to do is have you be completely prepared for yourself, for your parents, for your brother, whoever's coming up to this, because it is a huge decision. And there are times when you can't go backwards. There's situations where you need to make the right one at the moment, and that's all.
Yep.
So we're going to go through the nuts and bolts of it, and it's we're going to start at the 30,000 foot level. And we have a couple of acronyms that we thought up that are pretty cool.
we think we're really smart.
You might think they're hokey. They are hokey actually, but it's it's a way to remember the mnemonics, right? So there are four basic tiers of Medicare. Mm-hmm. There's Medicare Part A, Medicare Part B, Part C, and Part D. Okay, what is in Part A?
So why? Well, first of all, let's back up a little bit before we get into the details of Medicare. Why did they create Medicare to begin with?
Oh,
tell people why this thing exists.
Yeah, sure. So my grandfather was having heart attacks, from his 40s on, and so when he got to, and this was, he died in 1967, and so he and people in his age group were going bankrupt because they couldn't afford the medical bills. They had no insurance. They had no job.
Changed?
They were retired. They didn't have any money. And so you have a heart attack in the 1960s, you go to the hospital. It wasn't anything like it would be today, but you're getting wiped out. So the Johnson administration came up with Medicare, which was a plan for elderly people on Social Security to be able to get free healthcare or low cost healthcare.
Yeah.
I think it was free in the beginning, actually.
Probably.
But so it was a way to stop people from going, in the poorhouse.
Yeah.
Right.
Awesome.
Right.
Okay. So if you're 65, would you have to do anything special to qualify for Medicare?
You have to qualify for Social Security.
Okay.
So that means you have to have worked in 40 quarters.
10 years.
10 years, not in succession, but throughout, have worked in 40 different quarters.
Yep.
And if you qualify for Social Security, you qualify for Medicare.
Yes.
Part A and Part B and whatever, all of them.
And that could be maybe you never worked, but your spouse worked.
Right.
That counts.
Right.
You also have to be a U.S. citizen or a legal resident for 5 years.
Right.
Okay. And if you're under 65, how can you get Medicare?
You can get Medicare if you're on disability, Social Security disability for 2 years, 24 months. Or they have these little quirky things. It's the government,
this one is so funny.
If you have ALS, Lou Gehrig's disease, or if you are on kidney dialysis.
Just those two
random things.
Conditions.
If you have anything else, sorry, you don't qualify.
So I have Huntington's. I can't get Medicare.
You can't get that.
If I drank too much.
MS, forget it.
Okay,
it's not going to get that. Yeah. So anyway, So that's how you get it. And if you don't qualify, like say you had 30 quarters or something, you can just pay for some additional quarters to get into Medicare Part A. So
okay, got it. All right, and so you apply online,
right?
Medicare.gov,
right?
And you have 3 months before you turn 65 and 3 months after. So a total of 7 months
including
to get
the month that you turn 65.
Yeah.
Okay.
Total of 7 months to get your application in. If you don't apply during that period, you really should pay attention to this because you have to wait until the next open enrollment period to apply, and you get hit with a penalty. It's about 10%.
Forever. It's a permanent penalty for the rest of your life.
Yeah.
So you don't want to do that.
Yeah.
You want to be on the ball. Okay.
So there's your history. Now let's get into the nitty gritty of these 4 different parts.
All right. So we got these 30,000 foot level buckets of A, B, C, D. And then what we're going to do is we're going to drill down into each. We're going to go down into A, and we may get into some rabbit holes down there. And then we're going to come back up and go into B and get into some rabbit holes there, etc. Okay, so that's how it's going to work. We'll remind you when we're in the rabbit holes, so you kind of can keep it in your mind.
Okay, sounds good.
All right, so
Part A,
Medicare.
Think of this, remember the word admitted.
Right.
Part A is your hospital insurance. You've been admitted to the hospital, you're admitted into a nursing home, or you're on hospice.
Inpatient. You're an inpatient.
Inpatient stuff.
Right.
You're admitted.
So you're admitted. Okay. B. I love this one, by the way. We worked hard. We were on Facebook trying to come up. Give us an acronym for B that has something to do with mobile healthcare.
Hey, thanks, moms with careers, making it all work for this one.
Yeah.
So, B, think of the butcher paper. These are your... These are your doctor visits, your outpatient stuff, your lab work, things like, outpatient knee surgeries, preventative care, your mammograms, things of that nature.
Wait, knee surgery, that's in hospital, right?
Well, but outpatient surgical centers exist, and that falls under
that's
Part B.
That's outpatient. That would be under B.
Hospital.
Okay, I stand corrected. Yeah,
totally.
Yeah.
All right, so then W made some enhancements to this thing. George W. Bush.
Yep. He came out with Medicare Part C and Part D.
Okay.
Part C is basically a private health plan, like what you're all used to from work, a PPO, an HMO, Kaiser,
so
those kind of things.
Companies for Part C. You're buying insurance from a private health insurance. Well, you're doing it through Medicare.
Right.
It's a private company.
Not from Medicare, the government. Right.
Yes.
And D.
The only one that makes sense.
Drug.
D is for drugs.
Drug. Okay.
Thanks, government.
All right. So when you go into Medicare, you're either going to do A and B and C.
No. You're going to do A, B, and D. And D.
Sorry, yeah.
Even we get lost in this. It's totally confusing.
Or you're going to do C.
Or C only. So it's always ever C only or A, B, and D. You're never going to have C and A, C and D.
Right.
Only C or A, B, and D.
Right. So A and B is what you would call the traditional. Those of you that have been around for a long time, before we had managed care, like the PPOs and HMOs and all that stuff, there was something called indemnity plans, which basically you go anywhere. There's no network. The world is your oyster. You can go to any doctor in the country as long as they take Medicare. That's A and B. Okay.
Yeah.
And so you can go, like if you want to go to the Mayo Clinic because you have a rare disease, you can go.
You're covered. You
want to go to Memorial Sloan Kettering in New York City for the top cancers, procedures. You're in.
Yep.
So that's what A and B is. It's an open network. C, on the other hand, is you go where they let you go.
Yeah, it's more like the HMOs that we know, like Kaiser, for example, where everything is covered when you go in network, but you're stuck in that network with Part C. Another benefit of Part C that we have is that it includes dental, vision, and some wellness programs.
Right. That Medicare A, B don't have.
Right. And so if you spent your whole career on Kaiser, for example, and you're really used to that system, you're used to going to this, those doctors, and it's a great,
you just keep going.
Yeah.
Secure, I think it's called Secure Horizons.
Yes.
Keep it going.
You're right.
Yeah. Right. So that's okay. But here's the rub. If you go with A and B, should we go into the rabbit hole of the
let's do it.
All right.
Let's talk about Medigap.
So let's go back to A and B.
Okay. C gives you the vision and the dental.
Right.
A and B does not.
Yeah. So let's cover the differences of the pros and cons first. So on A and B, you can go anywhere in the country, but you don't have the wellness benefits and the dental and the vision and things like that. But in the A, if you go into C, you cannot, if you want to come back out of C, you cannot go back into A and B and get what they call a Medigap policy, which now we're going to go into the rabbit hole of A and B.
Yeah.
All right. So with A and B, the indemnity plan, they cover under the outpatient services and doctors and things. They have a deductible of like $205 every year. Plus they only pay 80% of the cost. So you're responsible to pay 20% under A and B.
Which, if you've been to the hospital lately, that can be pricey.
A lot it's a discounted price because Medicare says we're only paying 5 cents of whatever the thing is, but nevertheless, it can be pricey.
Yeah.
So you have to pay for the 20%. Well, people cannot afford the 20%, so they have what's called a private Medicare supplement plan, or Medigap. That you have to buy from a private insurance company, and you buy that at the same time you file for Part B, right?
Right. When you sign up for everything, you do it all at once. There are lots of private companies that sell Medigap. So literally you can Google this and say, Medigap policies, what's available in my area. There are also brokers that you can use to get a Medigap policy, which might make sense if you're not somebody who's super hands-on, or, you struggle to walk through this sort of thing and you want somebody to explain it to you. But asterisk on that, anytime there's a broker involved, there's a commission involved and a potential conflict of interest.
Right. They might want to sell you a more expensive policy.
Right. So just beware.
So on the topic of Medigap, this is where it gets really into a rabbit hole. There are different ways you pay for the premiums. Okay. There's 3 different ways.
Yes.
So one is you pay based on the age that you are when you when you make the premiums.
Yep.
And that is your attained age. So you start out low, like for example, around here, the Medicare premiums for an attained age policy with someone that's really popular would be United Healthcare, which is through AARP. And that one starts out maybe $125 a month. But it goes up every year based on your age. So by the time you're 80 or 90, it can be really, really pricey.
Ouch. How do people plan for that?
Well, they just think they get into it because it's cheap. They got 125, that's cheap. I'll do that.
Pay attention to
that.
Right.
But if you go to issue age, that's another way of doing it. It is based on the age that you started at, and then the slope of the growth of the premiums is much more shallow. So you might be paying $148 a month instead of $125, but it's going to grow a lot more shallowly, and you won't be paying as much when you're 80 or 90 years old.
I like that.
I like that too. For me, I could afford an extra $20 if I can buy the premiums down lower.
Yeah.
That's my choice.
Yeah.
But it's all about affordability, and you make your choices. And the third way is not age based at all, but it's based on the community you live in. So if you live in a community that has bad experience, high cost, like a high smoking area, or there's a lot of cancer.
Reno, Nevada would be considered a higher cost Medicare.
Yeah, I don't know. Yeah,
I would think. It would be. I haven't researched this, but like gambling, you have higher instances of drinking,
smoking, things like that, right? So you can get like a community based price, and so those are the three ways you can do it. For my money, my advice is to go with an attained age if you can afford it, because you'll get a shallower growth of the pricing. You won't be penalized for the community you may move to.
Yeah. Oh, that you may move to, which is an important point, because you may retire and you might be living in Danville, California, which is considered a very healthy community, and then all your kids move to Reno, Nevada, and you follow
you're there,
them.
and then you're really good point for sure.
So how do we even choose which Medigap policy we do, because they're so ridiculous?
Further down the rabbit hole.
I mean, Medigap policies also are lettered. Yep. They go A through N, but they skip some letters for some reason that doesn't make any sense to me.
A, B, D, G, K, L, M, N.
If you're in
it's the government,
if you start Medicare after January 2020, you can't get some of those. You can't get option C or F.
Yeah, right.
And so we're going to save you some time here. We really like option G.
Yeah.
It is the most comprehensive Medigap policy you can get. So if you can afford it,
that's right.
Remember G for go. Go with this one.
Right. G.
G for go.
And what happens is you're only paying the $205 annual deductible for Medicare Part B. And the way it works, if you get on A and B, for example, and you have a Medigap policy, you never see any bills or anything. Things come in the mail, but you're not having to do anything. It's like, it's informational, whatever.
What's that like?
I mean, it's like it doesn't exist. It's like nice. It's nothing. And it's so nice. Once in a while they didn't cover this $3 thing or whatever. It's minor. There are some things they won't do. Like, I think you can only get one cholesterol check every 5 years or something on Medicare, whatever. I mean, they have a discounted price, so whatever. I mean, there's some things that they're kind of quirky about, but in general, people I know don't have any bills.
That's amazing.
So that is really the way to go. So I think, A, B, and Plan G Medigap policy is really good.
Yeah.
Okay. So that's it for, do we cover A and B?
We've gone all the way through A and B and all the way down the Medigap rabbit hole.
Okay,
so
we're coming back out now. Right. We're coming back out and we're going to C.
Yes, we've talked quite a bit about C here.
Right.
So again, the pros are that you have more coverage in terms of dental. There's additional wellness, which that's kind of nebulous, but for the most part, it means like some acupuncture,
weight loss,
more
things.
preventative type stuff.
Yeah.
Everything is covered in when you're in network on
when
those
you're
policies.
in network. But they have I hate to say this, the old death panel thing, remember that?
Yeah.
I mean, you have managed care, so they could say, I'm sorry, we're not covering this because it's experimental, or, we just don't cover that, or whatever.
Yeah.
That's the kind of things you get. We're getting that normally in our jobs anyway for our healthcare, right?
Yeah.
It's the same thing. So you have to run that, gauntlet, and that's not fun, especially when you're old, and if you're not healthy and you don't have a good advocate looking out for you when you're in a depleted state. So that's a thing. That's a really
Well, speaking of a depleted state, if you find yourself on C and you need care that you can't get, you can go back to A and B, but there's a huge caveat here, and that is that you have to qualify for the Medigap coverage medically, right? So you have to be healthy enough to get that coverage. Whereas if you sign up for it at 65 during the initial enrollment period, you do not have to qualify.
It's a guaranteed issue
medically.
And so let's face it, you're not going to qualify. If you're wanting to go back to A and B because you're unhealthy, you're not going to qualify for Medigap. So you're stuck for 20%, and most people can't afford to do that. So that's why it's kind of it's a trap that you get into if you go to C because you think, oh, I want to get these extra benefits, but the price is, the gotcha is you're not coming out because you're stuck there, basically, probably.
Exactly.
And what they do, the reason they have these wellness benefits, honestly, is because they give you less benefits on the other side. I mean, they have the same dollars that Medicare A and B get, but they just kind of carve it up differently. So they give you these other bells and whistles.
It costs very little to give you a weight loss program. It costs a lot to do a gastric bypass surgery or something like that.
Right, exactly. So that's the pros and cons. If you think like, I don't care about getting, high-end cancer surgery and stuff, and I don't want to go to New York to get treated, then, you're probably fine with it with a C, but you just have to know you're not going to get back out of it.
Right.
More than likely.
So in general, our recommendation is if you can afford it, A, B, and D with the G Medigap policy is like the Cadillac of Medicare. Right. So A, B, D, G. Anybody does great.
Oh,
great.
Good.
It's
Okay,
great.
Yeah, okay, great.
Anybody does great. A, B, D, G. We're trying to help you remember this. It's so complicated.
All right. And speaking of
anybody does great. That's your plan if you can afford it.
Speaking of D.
Yes.
So C and D, one thing but we didn't talk about with C and D is they also have drug coverage in them.
Oh, yeah.
So if you're on C, it comes with a drug plan in it. And if you're on A and B, you don't have a drug plan in A and B, so you have to go get a drug plan separately. That's Medicare D, Medicare D. So those are drug plans that you have to, and these come up they're coming up right now, like tomorrow.
Tomorrow, open enrollment starts.
Enrollment.
It's October 15th through December 7th.
Right.
Every year.
And you have to pick a plan. And some people pick plans and they think, I picked my plan, I'm done. Let me tell you, you have to look at that plan every single year during open enrollment and check it again and see, is this suiting me and serving me, giving me the best benefits for my drugs that I take?
Yeah.
Because those premiums, for example, we routinely find people that are paying thousands of dollars more the next year or a subsequent year because the plans change their formularies, which are the drugs they cover, the tier 1, tier 2, tier 3, or the excluded ones, all that. And so you have to be on these people like white on rice, I'm telling you, because they're sneaky.
Yeah.
They'll come in with a great deal, then in the next year they change it. By the time you find out, you're over way over.
Was it last year that you saved $1,000?
Yeah, $1,000 a year because from the prior year plan because the drugs changed.
So all you had to do was log into Medicare.gov, enter the drugs that you were taking, and look at what it spits out in terms of what the best policy is for you.
That's
It's super easy.
Yeah, you put in your dosage, how many you take per day or whatever.
Yes.
And then it says, okay, based on this, and what pharmacy do you go to? You want to go to Costco? You want to go to Walgreens? What is it?
FYI, the online pharmacies are usually the best deal you can get. If you're not doing that already, look to an online pharmacy because also they'll automatically fill your prescriptions and send them to you.
Comes in the mail. Yeah.
Forget going into Walgreens.
You get a 90-day supply and it's cheaper. Yeah, for sure.
Yeah. So this is something that we advise all of our clients to do every year. If you're a DMG client and you want us to look at this for you, just send us the drugs that you're taking and we will shop it for you. You don't have to actually go do the input.
Right.
That's just a service we provide. And FYI, if you have a financial planner and they're not at least telling you to do this, let alone doing it for you, they should be.
Ask yourself why.
You should expect that service from them.
I mean, it's a value add that's really important because, the financial advisor should be saving you money and also besides making you money, honestly.
Totally.
Right? Yeah. They should be looking out for you. And this is a big one with these Medicare plans.
And again, you do all this at Medicare.gov.
Right.
So each year you just log in there to shop your drug plan.
Yep.
Please be careful of other sites posing as Medicare that aren't Medicare. Just go to Medicare.gov.
Oh, you think you're in there and you're not? Yeah, it's got to be Medicare.gov for sure.
And often it's like, someone else selling some supplemental something insurance and you think you're buying Medicare, but now you're buying some other policy and you didn't sign up for A and B. Oh my gosh, just Medicare.gov. Look at the URL the whole time you're doing this. Just make sure that you're always in
I
that
get caught in those things sometimes even. I know better. Yeah, it's terrible. Yeah, those ads are something else.
Yeah.
All right.
Okay, that was a lot of Medicare information.
Yeah, it was. Do we have questions?
Those are the basics. So let's take a look at some of our questions that came through here. Okay. 1 of our questions is, what is the difference between a 401k and a 401k? 2 of our questions is, what is the difference between a 401k and a 401k? 3 of our questions is, what is the difference between a 401k and a 401k? 4 of our questions is, what is the difference between a 401k and a 401k? 5 of our questions is, what is the difference between a 401k and a 401k? 6 of our questions is, what is the difference between a 401k and a 401k? 7 of our questions is, what is the difference between a 401k and a 401k? 8 of our questions is, what is the difference between a 401k and a 401k? 9 of our questions is, what is the difference between a 401k and a 401k? 10 of our questions is, what is the difference between a 401k and a 401k? 11 of our questions is, what is the difference between a 401k and a 401k? 12 of our questions is, what is the difference between a 401k and a 401k? should I use a Medicare broker or not?
Okay.
Oh, that's a really good question.
Yeah, that is.
Yeah, these people totally exist.
Yeah.
Kind of the same answer that we gave around whether or not you should use a Medigap broker or company, right?
Yeah.
I think if you don't know a lot about this, it could be a great way to learn more and have somebody explain it all to
Right.
you,
Right.
sit down and answer your specific questions. They'll be really knowledgeable about all of the options.
Right.
Again,
They'll cover the Medigap, they'll cover the Plan C and the Plan D for you if you want.
Yeah.
But they might want to sell you the most expensive one, potentially.
Again, just be aware
careful.
of that conflict of interest. Okay, let's see. Is Medicare mandatory? That's a really good one.
Yeah, that's good. So if you are a worker in the United States and you pay into Social Security, you're required to pay into Social Security, yes, it's mandatory.
It's mandatory to pay into Medicare.
Yeah, right.
But I think the question, is it mandatory to sign up for Medicare?
No, you can
when
stay
you're
on your
65?
company health plan.
Yeah.
So that's a good question. If you're in a large group health plan, a lot of times, like if you're in a retiree plan or something, a lot of times they will want you to stay on their plan. You pay the premiums to like the phone company or whatever company you worked for.
Yeah.
And they might have Medicare pay them some money to help supplement the cost. If you are in a small group plan, like our company is small, you have to go on Medicare.
Yeah.
You cannot stay in your company
Thanks
plan.
for turning 65.
I know, right? It saves us a bunch of money. But yeah, I mean, and that some people don't know that. I think, well, I'll just stay on my company plan.
Okay, what if I'm like Jeff Bezos? Do I have to sign up for Medicare? Like, I don't need it.
I don't think he has to. I mean, he can just ignore it.
Yeah, it's not mandatory. You don't have to sign up for Medicare.
No.
If you want to self-insure, go for it.
Yeah.
But again, if you're going to want Medicare at any point during, 65 to whenever you pass away, and you don't sign up during that initial enrollment period, you'll pay a penalty for the rest of your life.
And just to be clear, Medicare A is automatic. You get it at 65. There's no signing up for it. You just get
good
it.
point.
Yeah. B is the one you have to sign up for.
Right.
Yeah. Okay.
Good point.
All right, that's good,
Let's see. Oh, we have a few coming in here. What is the difference between Medicare and Medicaid? Oh, that's a good one.
You want to take that one?
These terms are they're really confusing. Okay, so Medicare is an insurance program that you pay into via your paychecks while you worked.
Right.
And you pay premiums for parts
Or
of it.
self-employed taxes.
Yeah, of course. Medicaid is a social program designed to provide medical care to those that can't afford it.
Right.
So a really easy way to remember this is Medicare is for the elderly and Medicaid is for the needy.
Okay. Good.
Okay, that's all of our questions.
No, we have one on dental and vision.
Oh, okay.
coverage. Yeah.
Oh, I missed it. All right.
So can you get dental and vision outside of Medicare Part C if you're retired? And the answer is yes, you can. You can go buy a separate policy. You can go online to like insurance.com or whatever. I don't know, some of those sites that sell individual policies, and you can get a vision plan for yourself. You can get a hearing plan. You can get a dental plan. And we like Delta Dental.
Yeah, I would be comfortable recommending that here in California.
It's a good value. They give you discounts and things. The dentists provide service at discounted rates.
Yeah.
And you could do that. Yeah. And there's one of the things going through Congress right now is dental and other benefits, vision through Medicare.
Yeah.
We'll see what happens.
If it's important to you, you can talk to your reps about it.
Yeah, you can talk.
Always a good idea.
Sure. Talk to your Congress people.
Yeah.
Okay, let's see.
Anything else?
I think we got all that.
I need my reading glasses.
I know, right? We have some
Darn aging.
We have a few things to share with you. First of all, we have our book, Endless Inheritance, that is about how to create a family where you can leave your wealth to your children and your family will thrive for generations. Angela and I basically both collaborated on this book. We wrote it a few years ago. That book is available for free right now. It's normally on Amazon at $19.99, but we're giving it away free. Here's our free book offer, so you can take advantage of that. And we also have our guide for this particular show that will be coming out in about a week. And it has all the information that you would need and resources and things to be able to get the information for you or for a family member.
So if those acronyms didn't help you remember, it's all written down somewhere. Just go grab it from our website in about a week. Right.
And also, we if you are interested in having a financial consultation with us, a financial wellness consultation, we offer those. We have free 30-minute sessions. You can sign up on our website. And also, if you have any questions, we're always open to questions that you might have.
Here.
Just get a hold of us, and we love talking to it.
Yeah. In fact, a client asked me a question this morning. She said, "Can I refer a friend to you? Are you guys taking on
No, we can't do that. No.
We are, in case you were wondering, taking on new clients. We have an amazing team, a staff team here, and we'd be delighted to be introduced to your friends.
Sure. Well,
remember,
you're invested and so are we. Thanks for being with us. We'll see you soon.
Take care, everyone.
Take care.